What is going on, everybody? How's it going? Happy Wednesday. Happy Wednesday. Thanks again for joining me for another We Are So Back Wednesday, BG Cast Wednesday live podcast. Couple of things real quick I want to throw out before we get to my guest. I didn't realize I broke 300 subscribers on YouTube. That was pretty interesting. Of course, you know, though, YouTube is not necessarily my home place. Rumble is my home place. That's usually where I put most of my content up. YouTube is just a byproduct, but I just want to say thank you guys. I appreciate that. Thanks for all of the new subscribers on YouTube and Rumble. And thank you guys for joining the BG Cast family. It is much appreciated. And you all are the reason why I do this. If this is your first time here tonight, please give me a like, a follow, and a subscribe if you like what you hear. We are diving into volume 2 of Exposing Medical Tyranny. We had Joey Sky on a couple of weeks ago to tell her story. I have another guest that is coming on to share a very similar story. And, you know, one of the things I want to just throw out there real quick, what has inspired me to kind of keep going forward with this section of BG Cast is I have myself had very interesting and strange experiences when it comes to the medical industrial complex, this healthcare system. All of you know my opinion on the healthcare system right now. And it is avoid it at all costs unless you have an emergency. That is basically, don't get me wrong. You get shot, you get your arm cut off. Yes, go survive, go get help. Don't get me wrong. But if you are a spiritually awakened individual, okay, my advice to you is to look for other forms of preventative medicine. There seems to be something weird going on with people like you and I in this healthcare system. But nonetheless, let's dive into my guest. So she has a story she's coming on to tell us right now. This is her first time really that she's breaking into the open, and she's kind of talking about this story in a public space. It is about her son and a really harrowing story of a situation that her and her husband had to deal with her son when it came to dealing with, pediatric doctors. Of course, we've seen this trend with pediatric doctors. There seems to be something very strange going on when it comes to this. So nonetheless, let me introduce you to my guest. Her name is Katie, and we are going to call her Katie Catalyst tonight. Let's bring her on the stage. Katie, how are you tonight?
Pretty good. How are you?
I am good. Thank you so much for being here. And thanks for taking time out of your life to share your story. So before we dive into your story, I want to talk with you about your spiritual evolution a little bit, your spiritual awakening. I know you are also a kundalini yoga practitioner.
Yeah.
So that makes me happy to hear that. So if you don't mind, why don't you dive in a little bit for everybody, kind of give some background on yourself and what you do.
Yeah. For me, it all started like 2011, which I think was a very strange year in of itself, and going into 2012. And it was like 11, 11, 11. Going to a meditation teacher, had some really transformative experiences. She introduced me to kundalini yoga, really kind of blew my whole reality open. A lot of crazy experiences. From then with Awakening, which is like a whole novel in of itself, but that was like 10, almost 15 years ago. You know, a lot of growth and growing. I met my husband right after that. We've been together ever since. Done a lot, like went to Los Angeles and back, and just kind of living the life and just trying to be an embodiment and just doing the things, living life. So spirituality can be so esoteric, but like you said that one time, like talk is talk, and it's like all about really living it. And it's not about like all the things, but I don't know.
No, that's awesome. That's awesome. No, I totally get it. When it comes to a lot of this stuff that we experience, especially in our spiritual evolution, there seems to be a shortage of words. Words don't really, they fall flat when kind of describing a lot of the stuff that we experience in our growth and, these spiritual experiences that we have. And it sounds like it's been one heck of a ride for you. It's one. Congrats on meeting your husband after all of this, and
Yeah.
together ever since. That's super awesome. And it seems like it opened the door for you into this kind of new way of being, this new way of seeing this existence and experiencing it. So that must have been an amazing thing.
Yeah, still is. Love it. It just puts everything in context, and every experience can be divine and magical and exciting. And even if it's harrowing and dark, like that's like why we came to be human, to really experience the depths of reality. And that's kind of really where this harrowing story gets to, because like as great as life can seem and like you feel when you're having a spiritual awakening, life hits hard sometimes, and you need to really be able to fall back on that. And that's kind of what I learned throughout the experience, to like really, be that stillness even when there's total chaos and like a storm brewing around you. I think that's so relevant to our world today, because I mean, chaos is everywhere, and it's just going to get more chaotic and more strange and more weird. And we really need to have like our wits about us. And that's in the medical community, when advocacy is so important. Like you really need to have your wits about you. You need to be like on point. You need to understand what's going on and make like aligned decisions. And it can be so hard, but that's why we're here.
Absolutely, absolutely. And one of the things you said that I want to point out, it's about finding peace in the chaos. I hear so often people, they always say this. They're like, once this happens, I will be at peace, or once this happens, I will be happy. And what you're doing is you're you're giving away your power. Ultimately, you're giving your power away to exterior circumstances that are dictating your emotional state, which you can control on your own, and that you have the power to do so on your own. And it's really just the realization and the remembrance of that power that you have. And but here's the thing: the reason why, at least in my eyes, and then we'll dive into your story, is it's so hard for a lot of people. Once you come into this power, a new sense of accountability and responsibility starts to take control. At that point, because now you see that you are the cause of 99% of your reactions. Your headspace, like all of these consequences of your actions that occur to you, and all of that. And sometimes for a lot of people that can be immense, but and that's why it's good when we finally break past that wall, that victim mentality wall, and then we take that power back into our own hands. To me that's one of the most beautiful things. We have some people in the comments kind of, oh, responsibility. Nobody said this was going to require work. I'm going home. David's definitely just joking. David's in there just like we are, for sure. And then we have Don, and then we have everybody just giving shout outs to you. So, all right, Katie, let's begin. We can start from wherever you feel comfortable starting in this story.
Sure.
So let's start from the beginning, and let's kind of take everybody through what happened. And, of course, I have some questions I'm going to ask you in between. So, once you get to kind of a pause where you're at, I might pop in and ask a question. But yeah, so why don't you enlighten us on this experience, and let's bring it to light. Let's bring it to awareness so other people can know what to look for if they ever experience something like this in their lives.
For sure. I guess, kind of like where I just left off, like I met my husband, we were together for a long time. And as like a typical millennial, we really kind of waited to like really get our life started. So then, we'd been together for a while, and we finally got married, and we just desperately wanted to like live God's purpose by like having children and, raising a family. And that was just everything we wanted. And it wasn't as easy as we thought. And I like people to know that, like, if you ever want kids, like, I just say, don't wait, don't wait. And so we finally conceived. It was Easter time. It was beautiful. And like everything seemed divinely aligned. And I've heard this from other people who've had harrowing experiences that like in a way don't make sense. You're like, why would this turn out this way when everything seemed like so divinely guided? And we found out later on that our baby Benjamin had a really severe birth defect, and we were going to be in the hospital for a while. So it was just kind of, there was no way out of that. So that was just kind of what we were put into. And it's kind of like, this is what you got to deal with. And crazy enough, like I had a psychic who had, people tell you, psychics just tell you what you want to hear. But like, it's crazy that I had a psychic tell me that like, oh, your first child might die and you need to make sure that you go to all of your appointments, which, I mean, there could have been a real chance that I didn't. And I was really naive, like, oh, these appointments aren't doing anything. But ultimately, they did give us more time with our son. He was born with severe defects, congenital diaphragmatic hernia, and his lungs were really squished. And I remember it being like 11/11, and we went in, we had like the highest hopes. That November, we were giving birth in December around Christmas time. And I was like manifesting miracles, and they told us it was more severe than we could have ever thought. And so that was kind of shocking when you don't get the news that you really think that you're hoping for, and to like have perspective in that. Going forward, he had to be born into like a level 4 NICU, and his level of care was so immense. And for those first few weeks, it was like a big whirlwind of trying to understand his care. There was so much to it. And I know so many parents who have been in this position, and they just ride the ride, and they listen to everything the doctors say, and they say, yes, sure, you do that. And they don't see like their choice in the matter. And we didn't see that until it got very dire. And he had very severe pulmonary hypertension, and the treatments weren't working, which is like one of those things that's like, ultimately, I feel like our medical community knows so little. Like they can stitch you up, but in terms of really curing, fixing, treating, like they just really don't know it all. And they always like to pretend that they know it all. You can't tell them anything, and they're the expert. That's a really hard position to be in. And so ultimately it got so bad. He was on ECMO, which is a lung heart bypass machine, and they couldn't get him off. We tried and tried, and like everything seemed to be failing, and like things were, just not looking good. And they told us, like every doctor came in the room and told us, like, your son is going to die. And then like we just like looked at them and like, okay, sure. And I just, with my whole body, my whole spirit, me and my husband, we just didn't believe it. We just did not believe it. Like, I was like, they all thought, we were delusional, as they will, because they don't see faith. They don't see, outside of what the data is telling them generally. We did have like one person on our team that was a little bit more spiritual and faith-based. She was really there for us, but she could only do so much. She was also fighting the whole system, and it's like the whole system is working against you because they're not really there for ultimate health and healing. They look at you almost like a dollar sign, and it's like they wait whether like your life is worth it. It's so dark, but we really didn't believe he was going to die. And they all wanted us to just cut the cords and let our son die. They're at 6 weeks old. And we were like, we don't want to do that. We don't want to do that. We don't think he's going to die. And so we started like exploring what our other options are. And I know a lot of parents don't do that. They just take what is told to them and they
Mhm.
say, yep, gotta let them go. And they let their child go. And I feel like, in a way, we did choose a very hard path, but I mean, it was just the path that was meant for us. There was just no other way. We could have chosen something else, and that's just the spiritual path, that the decisions that you're destined to make. So we wanted to go for surgery to just try and get him off and give him every chance he possibly could to survive, because we really, really believed that he was going to survive. And then the day came and they did the big surgery, and it was just really heart-wrenching. Our surgeon, who was also one of the very few great people on our team, she was like nearly crying because she didn't want our baby to die on her hands. Like, they wanted it to be our,
Absolutely.
to just let them die and not be their responsibility when the child dies. But they did the surgery and he miraculously did amazing. He did so great. He came off like no drop in any of the vitals. He was completely stable the whole time. And it was just like the biggest miracle. And everyone was so shocked. Like, every single doctor, like, there was a meeting. It was also on January 11th, where all the doctors went around the room and all told us that they were going to die. So it was just like such a thing. And then when he didn't die, it was like they all pretended it didn't happen at all. Like,
What?
and
Well, so one thing I want to ask you real quick. Sorry, I just have a couple. I have a couple of things I want to ask real quick. So,
yeah.
one of the first things. Have you ever heard of something called medical hexing? Have you have
No,
you
I don't think
ever
so.
have you ever heard of that term? So one thing, a lot of one of the biggest things doctors do is they take advantage over the
Oh,
fear that you're currently in.
yeah.
When it comes to, of course, in this situation, I can understand as a mother, as a parent, you're absolutely like, oh my god, at that point, at everything that's going on, it's easy to be overtaken by that. But
Yeah.
so what medical hexing is, so there's two. I'm sure you've heard of the placebo effect, correct?
Hmm.
Like, you've heard, or we have the ability to use our consciousness to heal ourselves if we believe something works, right? Well, there's also a negative. There's a negative polarity to the placebo
Hmm.
effect, and it's actually called the nocebo effect.
Hmm.
And the nocebo effect is what's known as medical hexing. And doctors tend to do this. They tend to come in and they put you in that state of darkness. You're not going to make it. Your son's not going to make it, vice versa. And what this does is this interacts with your consciousness and your outcomes for the situation. And the one thing I'm going to say is this is, I know there's altruistic people in healthcare. Don't get me wrong. The majority of them, though, it seems to be that they are not in it for the right reasons. A lot of it is very much so money driven. A lot of it is very much so this air of darkness that just happens to kind of come over these situations like this, instead of looking for ways to actually help and even exploring different options outside of their pharmaceutical medicine that could potentially help. They don't do that, and I want to say I completely agree with you. They know, somebody just said this mama bear is feeling her right now, so you have people who are definitely feeling you on this right now. And but and this is what they do. They want to trap you in this corner to make you feel like there's no other way out, and they don't really know that much when
Yeah.
it comes to certain things. And even if you open up a medical textbook and you look at it, all of these things that we think doctors know about, or they're educated about, and things like that, they read it so very little. There's very little bits of these things in these textbooks, and they don't showcase all of the knowledge, or they withhold the knowledge. But nonetheless, I'll continue, please, as you were going.
It's so true, and it's like we live that, and I know so many people have fallen into that, and ultimately, it's like they think they get to decide who lives and who dies. It's their decision. And that is just so wrong. It's like against, I think human rights to that for someone to look at you and say whether you get to live or not. And
Mhm.
it's so crazy. And a lot of people don't realize that they do have choices in that. And so like that's really when we kind of woke up like in this blur of medical care. And we're like, we were backed against the corner. And then we're like, we got to start
Mhm.
making decisions and and figuring out what is really best for a child, because you know letting him go we didn't feel like was best for him. But
Of
I
course,
mean,
of course.
some people think that, oh, it's just better to let them die. And I just felt like Benjamin deserved life. Like I feel like everyone deserves life, and I feel like everyone deserves to have someone fight for them as well. That's what parents
Mhm.
are here for, to fight for their children.
Absolutely.
So we really took charge of Benjamin's care and kept offering a lot of suggestions and, really putting, um, what we wanted first and foremost for Benjamin. And, it was things seemed great at first. We were kind of really riding that high of like that
Mhm.
miracle. And then things started to get like a little bit worse and a little bit worse and a little bit worse. And like then like all these mistakes started happening. Looking back, it almost seems like how could logically any person like make all these mistakes? Like they completely botched his sedation, which I think is a huge issue, especially, in a post COVID era. Anytime
Mhm.
they put someone on intubation, which, Benjamin was intubated for a really long time, and that was hard to try and get him off ventilation, and to have like the most gentle ventilation possible to help serve him going forward.
Mhm.
And they ended up doubling his sedations, then tripling his sedations, and then adding more sedations. And I'm like, how could you do this? We're supposed to be pulling back on the sedations, but it was like too much, too little, too much, too little. Let's add more, let's add more. It was just so crazy.
And
And
that's
so
dangerous
again,
too, because I saw that they were using opioids in that sedation as well. And I have that email that you sent me here. And especially with children, that's something that you've got to be absolutely careful with. You there
it's so
there's
much worse than that. He was on at 1.7 different sedations. So he was on IV opioids, and they couldn't get the IV off. So they doubled his opioids with PO sedation. So he was on IV, and then they gave him the same amount through the mouth, just doubled it, because they're like, we really want this IV out, but we can't get it out. So let's just put it in the mouth and then not even change anything. And then he was on benzodiazepines, which is like very common for any time in the ICU. Benzodiazepines, anti-anxiety medicine, Versed. He was on IV Versed. Then the next week, after they had doubled his opiates, they were like, well, let's try with the Versed, the anxiety medicine. Try to pull out the IV. They couldn't do it. They put in oral um, Ativan and various other same things. They couldn't get the Versed off, so then he was on Ativan. So he was on morphine, methadone, Versed, Ativan, and then the pharmacist comes in and was like, "Oh, then she wants to put him on a nerve killer." Um,
I
and
just to me it's like I'm listening to the cocktail of the things you're saying, and for an infant,
Yeah.
practically a young child to be undergoing this kind. This cocktail is known to kill grown adults.
Yeah.
That
He's
that
on
you're
so
talking
much.
about right now. It's continue. I'm sorry.
The doctors almost didn't know how he could tolerate it, and I think he could because at the time his stomach wasn't really digesting or processing. So like they were just like wasting all these medications, and I think like was this all for kickbacks? Like because I just know they get all these kickbacks for prescribing medicine, so they don't get a lot of chances to just throw all these sedations out. And so then they were like, put all these sedations in, and they were like, let's just leave them. Like, what? Like this,
What the what?
and then at the time he was like, then addicted to them. There was nothing else we could do. Like he was so, and then they compromise your heart. So then his heart started like failing all the time. Like it would just start dropping out of nowhere. And I was like, none of this was happening before they like messed up all the sedation. And then, it suppresses your will to breathe. That's why they use it in
Mhm.
anesthesia. So that if I tell this to people all the time, like adults, older children, like if you're on a ventilator and they're giving you too much sedation and then telling you you can't get off a ventilator, it's because they're giving you too much sedation. Like you
Mhm.
can't breathe, and then they start to overventilate you. Then was like they started to like really push the ventilator pressures. At first they had a protocol which like we like really believed in for like very gentle ventilation for a tiny newborn infant with fragile, frail, tiny lungs. And then it was kind of like that was out the window. We're going to do like a chronic, and then just like increase the ventilation pressures more and more and more and more until, you know, going forward, eventually down the line, it's like they told us at 6 weeks he was absolutely going to die. And my son lived in like 6 months, 7 months, 8 months. Like he's still on an IV, and those doctors told me at like the second month, oh, they had to get the IV sedation out. I'm like, that's ridiculous. Like IV, like we can't like work on like giving him food. Like they didn't want to give him feeds. They just wanted to mess with his sedation and stuff. So
That seems like their priorities are all off because I mean you're looking at a living being. You're looking at a living human child. He needs food. He's growing. He needs food. He needs nutrients. He needs vitamins. He needs all of these things. And I agree with you. I think there was kickbacks involved. There had to have been something corrupt and dirty for any normal human being who has any kind of awareness or education on these compounds and these drugs that were being used.
yeah.
Like I said, I've seen this combo kill grown adults. Like I still can't in my mind and in my head kind of understand what was running through their minds. But continue.
Yeah, and we talked to the head pharmacist a lot because we were there all the time, and um, so then she gave him gabapentin. So that's another, and she like made it seem like, oh, gabapentin's like so, like easy going and just like calm your nerves. Like, no, I didn't know at the time, and it's like hard when you don't know something until you know. It's like that is a physically dependent medicate, like you grow physically dependent on it.
Mhm.
And then she wanted to give him an antipsychotic to help
What?
him sleep. So then he was on risperidone because all of a sudden there's like this new experimental thing, like let's give pediatric ICU patients antipsychotic medicine to like just help them chill out in the ICU. So then that ended up being 7, 2 different opioids, 2 different benzodiazepines, gabapentin, risperidone. Oh, and then when they tried to go off, uh, oh, then he was on Precedex, which that was the one who ended up killing him in the end because they overdosed him on the sedation. Precedex, which is commonly used for surgeries, never to be used long term. They never prioritized coming off the Precedex. And then when they did. They just put him on clonidine, so he was on the same medication but orally, and they never prioritized coming off of that. And then, if something went wrong, they would just give him more. So then they were back on Precedex and clonidine. And it's like, I know people in other hospitals that have sedation management. It's like, they don't do that. That's like absolutely negligent. And that's what I'm saying, that like not all doctors make good decisions, nor do they really know. And it's just absolutely crazy how like you can start see the mistakes happen and then they add up. And it's like, this is life at hand. But at some point we just had to like surrender, because we couldn't go back in time and fix all the mistakes that they had made. We just had to like deal with them. But yeah.
Well, the one thing I'm going to say is,
Yeah.
well, I just want to say this real quick. There seems to be a trend with pediatric doctors trying to give kids antipsychotic medicines.
I know, yeah.
And let me the number one thing, because I remember this from Joey's story. They were trying to, the kid just had a brain tumor, just got this brain tumor removed. He's going through chemo, radiation, all of these things, and then they want to put him on an antipsychotic. I'm like, what is going through? Because let me tell you something: the side effects of antipsychotics are not chilling you out. And the thing that I kind of laughed about a little bit was like, oh, it's just gonna help him chill. I'm like, you got this kid on fucking morphine, on fucking methadone, on Ativan, and you're telling me that you need to add more to this chill at this point in time.
Yeah.
To me it just seems like they were talking out of their ass. But there seems, one thing I'm theorizing the antipsychotics are for, that they're attempting to use these compounds for, because I'm going to tell you something like Haldol, it gives you something called akathisia, which is an inner restlessness. It makes you anxious. It gives you restless limbs. How is this going to help somebody in this setting where they're already under this intense sedation? They're already under this intense anxiety, this intense stress. We have Sam piping up and saying they use a lot of this protocol with elderly patients with psychiatric issues. Exactly.
I was
so
just
why
gonna
is
say, when you're an adult and they put you on a ventilator, you can't talk, and then they start drugging you so much so you can't think straight, and then there's no way you have any idea what's going on. Like, you need a medical advocate. Like, as like for our family, like we need to make sure. And like during COVID, how they like locked these people in these rooms and then just killed them. Like, it's just so crazy to think that like we were in a situation that was so similar. And I just can't believe things like that can go on, like as like an empathetic spiritual person. It's just like, how is that even possible? But that's the world that we live in, and it's crazy. So yeah, and then at one point there was concerns that Benjamin's problems were all about getting delirium, because then when you're in an ICU in a hospital and you don't see like the light of day, and you don't know day from night, and you're on all these medications, you have no idea what's going on, then you start to get delirium and you literally start to lose your mind. And so then they're like, oh yeah, we think he has delirium. So then they put him on and off ketamine for a while. So especially like he went to like one surgery and he was on ketamine, and then they didn't prioritize taking him off, because like one bad thing would happen, but like, nope, we got to leave all of these drugs on there. So he was like tripping on ketamine as like a 6-month-old infant for like 4 days. It was just like, you just can't even imagine, like, and you're just like trying to save your child, and we got so close to getting out, and then one day everything goes wrong because people make mistakes, and you lose their life. And just, I know Benjamin's soul came to like teach us so much, teach me specifically, and oh, I don't know. So where do we want to go from here? So,
I know. So one thing I kind of wanna talk about with you about this is you talked about some very spooky and paranormal things that occurred during this whole period of time too. But if you don't mind kind of diving into those just a little bit, because this is also something Joey experienced in her situation with her son as well. And everybody's saying like, I'm all for ketamine treatment, but what the fuck? Like,
until you're on it for 4 days.
and even Andrew's like,
And
I
it will
enjoy some
torture
ketamine,
you.
but for an infant, and and even Don was chiming in here just a little bit ago. He's very upset at your situation, and they give gabapentin and to people in rehab for addiction and things along those
Yeah, like a
lines.
step down. And that was like the pharmacist was like, oh, we can use gabapentin to help come off all the other meds. And then when the sedation, they had the plan to come off sedation, then they wanted to come off gabapentin first. So it was completely opposite of the entire reasoning that you said to be on gabapentin to come off the other medications when you just want to come off gabapentin first. And that's when I think like, oh yeah, like, I mean, do you want to keep them on like double opioids even longer? Because I just feel like that's where the big money is. Like, because it's like people want to sell opioids. And it's like, oh, great, we have a reason to just sell all these opioids. But spooky things in the hospital. I mean, it started like all the machines would just like malfunction a lot. And it kind of felt like there was like, I just like you're in a hospital, like so many. It's just there's just sometimes like this darkness that would come that like you feel like those spirits that are like preying off like the loosh and stuff, and they just like want to like it's like almost like this like demonic entity that like wants to make it as bad as possible. And so like we had a lot of problems with like specifically like the ventilator just like malfunctioning, and like you have little perspective, so I just remember being there and like the ventilator is like alarming all the time, and I'm like looking like, what is this machine saying? And the nurse was like, don't look at that. You shouldn't be looking at that at all. I'm like, what are you talking about? I shouldn't be looking at it.
So why?
Like,
Well, that's weird. Why wouldn't she want you to know what that says? That's
because they
strange
don't
to
want to be
me.
held responsible. They would rather you be ignorant and have no idea what's going on and just let them tell you whatever they want to tell you. They hate it when people start to figure things out. And then all of a sudden, like you become like an adversary, and it's like really hard to be like, no, like we're supposed to be working as a team. Like we are all part of a care team. And it's just hard and terrible. But yeah, then like I started noticing these patterns, like, okay, like this same error message keeps coming up all the time, and then it keeps coming up more and more and more, and I'm like, this is malfunctioning. So there were a couple times, because I had learned the first time, then one of the respiratory techs come in and then they just replace a cord, and they're like, it had never happened ever again. So it was like the cord was malfunctioning. Then like months later, it's happening again. And I'm like telling them, I'm like, yeah, that flow sensor cord is malfunctioning. That's why you keep getting a flow sensor error like every few hours. And then the machine would go berserk and it would mess up the ventilation. And like for someone who like can't breathe without a ventilator and is also like, critical, it's like, like they rely on that to live. It's like these kind of complications, like they just brush off like that's just how it is. And then nobody wants to fix it because nobody wants to be held accountable. And then they all want to think that like you don't know anything. It's like we got to a point where we knew a lot more about those machines than most of the techs. And like these are like very, very young people who are like just out of school. And, I don't feel like they're like super expert by any means. They're just taught the bare minimum to do their job. And then like the nurses don't even know how to use those machines, and I would tell the techs and the nurses and the doctors about how to use these machines because we had been there so long, and there was so much they didn't know. But yeah, the machines
I
malfunctioning and just feeling like spirits. And I mean, it was like a good thing when Benjamin came off ECMO and he was like miraculously saved. There was one IV pump that was just like blaring for some reason. It was like, like this is like the weirdest thing. All like while his life is being saved, and like, just I know there's like
it's
there's a lot of spirits that are in a hospital.
Oh,
And
absolutely. I was going to say, did you notice any of this? Because when we talk about the loose spirits, like you were
oh,
talking about these negative entities, did you notice? Because it sounds like you're a spiritually intuitive individual. I'm just wondering if you noticed if it overcame any of these healthcare professionals or it worked through them in some kind of way, because this is something we can see go down. And especially the fact that they didn't even want to be transparent with you
mhm.
about what was going on. And it seems like they were just trying to put your son on any and every drug that they could possibly think of. Leads me to believe there essentially was some kind of darkness, because according to them, in their narrative, in their eyes, they said your son wasn't supposed to make it, but he did. So they got proven wrong on the fact
Mhm.
that your son was not going to make it, but he ended up making it. So and to me, what it kind of seemed like, and this is just my theory, you can correct me if I'm wrong, and how you feel about it. It seems like that darkness almost wanted them to see it through, that he did not make it, because it had kind of put their egos in check. It had
Mhm.
proved them wrong. This young child, this little baby boy, ended up, against all odds, pushing through this, surviving, being living, having that will to live within his little heart, and it seems to me that these doctors, it didn't sit well with them that he made it. That's the impression that I'm getting from the whole scenario.
Yeah, I mean, there were a lot of people on the care team that I thought were like borderline abusers, like very like sadistic. Like I wonder how most people can be a respiratory tech and just shove tubes down people's throats. It and sometimes they were just like so rough with like hand and like and with Benjamin he was like so sensitive and so critical, and like you need to be gentle, like you're like what are you doing? It's like so crazy. You just want to be like stop, but like a lot of times like you have to be like as calm and like reasonable as possible. A lot of like nurses that were just like really overly negative, and then like we had one doctor um who like I honestly thought he was like the newest like doctor who had no idea what was going on, and like he wasn't like very
Mm.
educated. From our experience, it didn't seem like he knew like what was going on, like the least educated doctor on the team. And come to find out he was like the lead doctor of all the NICU, and I was like that is crazy. And he really like wanted nothing to do with the care because like we were trying to save him and he didn't seem to care. And like he came in and he's like, I don't understand why it's so hard to just let your child go. People seem
What
to,
the?
it's like so much easier to let a parent go. Why is it hard to let a child go? Like,
Because that's not supposed to go down that way. You're supposed to
yeah.
outlive your children. That's to me, and the fact that this left this man's mouth. Spinja chimed in real quick. She said they signed up to heal people, but are more concerned about being right.
Mm,
Absolutely, that's something.
that's
You
often what it is.
often, a lot of us who have undergone some kind of weirdness in the healthcare industry, we've experienced this, and
Oh
but
yeah.
a doctor to come in and say that to you, why can't you just let your son
Yeah.
go?
And it was
That's
one of
darkness to
the
me. That's
worst nights,
darkness.
that we were there. It was so confusing, like, I mean, it's, like, burned into my skull, like, I was in our room, we had a hospitality room on the other side of the hospital, and my husband called and was like, "Benjamin's not doing well," and I, like, leaped out of the bath and, like, ran through the whole hospital sobbing because I thought, like, this was the night that we were gonna lose him. He was about 2 months old, maybe 2.5 months old. He had said that, and we were just, like, really unsure about things. So I was like, I want to hold him. So we got him off the bed, and he's, like, really critical. And it was, like, really terrible. Like, his whole body turned cyanotic. It's, like, super, super gray. And we were looking at the screens, and his oxygen saturations were, like, 20. And then they would go down to 7. And I'm like,
That's not good.
7? Like, people think, like, how can you live like that? Like, obviously he's gonna die. And, like, I really thought, like, those might have been, like, our last moments. Like, like, I guess he's just gonna slip away. Like, they had given him then a paralytic because that was, like, one thing that he was on and off to, like, help stabilize him. And, it was just, like, really, really sad. And my husband and I both agreed that that was, like, not how we wanted to, like, let Benjamin go. And it was
Absolutely.
the weirdest thing. So it was like 2 hours, his oxygen saturations were like 0. And, like, all the doctors said, like, "Oh, then your internal organs will just start shutting down. You'll go into acidosis and then you'll die." And then, like, "Oh, your heart will fail. Like, that'll be the end." And then we sat him down and he just got better. And it was like it was all in the past. And then
Probably
he was like
because
the
he
next
had his
day.
connection with his mother. Probably
Yeah, it was, like,
because you were
so
holding
crazy.
him.
Yeah, but, like, it did almost seem like that doctor really wanted him to just die because it was, like, almost like they didn't wanna have to worry about it. They don't like to have to worry about big problems that they might face the reality that, like, "Oh, we don't really know what we're doing, and we don't really know how to heal him." And instead of, like, just exploring all other options, that was, like, one thing with, like, I feel like with Joey's story, it's like, "Well, why can't we try something else?" No, that's, like, not an option. I know so many other people, "Your child's gonna die." "Okay, can we try something else?" No, that's not an option. You let them die or do this. That was it. And, like, I know with so many, his problem was his pulmonary hypertension, and they were, like, increasing his medicine so much that was making his pulmonary hypertension worse. Once we started to get light of it and I started to realize the patterns and see, and, like, Benjamin's spirit would, like, speak to me through me, and, like, and I would start to see things that I feel like he was telling me about, like, what needed to be changed. And then, through the light of God and, divine interventions, like, people, the right kind of information would come to you, the right kind of people would tell you these things. And I had a friend whose baby was saved because at one hospital they were upping his medication. He was about to die. They transferred him and they lowered the medication, and he miraculously was completely fine and then went home. And I was like, that's what needs to happen to Benjamin. It's like, as the medication kept increasing, he was doing worse. I was like, we need to go down on the medication, but these doctors don't think that's an option. They're like, "Oh, yeah, we increased it so much, they're doing worse. They need to die." It's like, well, can't we just go down on the medication? And they don't want to do that. So I fought so hard then in the end to get a second opinion, that another hospital, because that's the other frustrating thing, that, like, different doctors, different professionals, different hospitals all do different things. But then you're going to have one doctor who's going to pretend that's, like, the only option. And so then
Exactly.
it's like, there are other experts, other professionals who know what they're talking about, who do things differently and things work better, or, like this could
Mhm.
work. And, like, ultimately it should be the patient and the parent's choice. But there comes a point where there's, like, such a battle over the treatment plan. Like, the doctor wants to make those decisions, And even though they like try to say that's like, oh, like it's your patient right to choose, they try to take that away as much as possible.
Absolutely, absolutely. And we've seen this firsthand that if you try to go an alternative route, which it looked like you and your husband were trying to do, you wanted to get a second opinion. This is when they start bullying. This is when they
Yeah,
start,
it got really bad.
involving CPS. This is when they start involving. I mean, you would think you would take this common sense and you would see that, you lower the medication, he gets better. You increase this, cocktail, man. It is a wicked cocktail. To me, one of the hardest things I'm having to deal with while I listen to your story is how in the hell they're obviously not sane people. They're obviously not right in the head. Did they think that they should be giving this combination of drugs to a child? That is, I mean, the ketamine's, and not saying he should have been on ketamine, at least in the scientific studies that it has on ketamine, it is safe for children in that aspect because it doesn't reduce like breathing as much. But to have him on morphine, methadone, Ativan, plus the ketamine, plus the all of this other stuff,
That's like
it's and they want to put him on an antipsychotic. To me, I agree with you. It's almost as if they didn't want to take care of it. They didn't want to do their responsibilities as healthcare professionals and do everything they can to save this child's life.
I mean, ultimately, it was supposed to be to stabilize him, and so it was like a really, really terrible Band-Aid to cover up their other mistakes, and I think that is so typical. Like you take like a COVID patient, like you put them on like propofol, and then or like remdesivir that starts like shutting down their organs, and then it's like, oh, they're doing bad. It's like, oh, they're critical. They up their sedation so that they're comfortable. They want to make them comfortable. Um, but it's really in a larger sense just covering up their mistakes and their failed treatment plan, because like you're not getting that child better. And then it's like once the mistakes start adding up, everything becomes so convoluted. And when you're on then the over medication, which is so common, like you're on 27 different medications, because he was like, it was just like such a long list, and things start getting bad. They don't like to go backwards. They just add more. They're like, oh, like let's
Mhm.
just add this medication. And they're like, there came a point where, cardiology would come in. They're like, oh, well, we want to try a different medication. So they change the medication and it shuts down his kidneys. And then, the nephrologists come in who take care of the kidneys, and they're like, they cardiology almost tried to kill them. Like, of course they shouldn't prescribe them this class of medication. It's, terrible on the kidneys. Like they can't do any of these classes. It's like the fact that often the specialties don't work together, and specialties only know so much about like one specific organ. They don't ever really seem to know about the whole health, holistic health, like whole well-being, to take care of the whole body together. So it's like
Mhm.
all these specialties working against each other, just adding more medication. And when
And what
somebody
blows my mind, if you don't mind me just saying real quick, a lot of these specialists are trained in these interactions with these medications. So for them to act like they had absolutely no clue, to me is complete and total bullshit. And that's I'm just throwing that on the line because these specialists, they're aware. Especially these people that dispense these medications, these pharmatechs, these pharmacologists, things like that. They are well aware
yeah.
of the interactions that these medications have with each other. So for them to just continue to just keep piling and piling and piling the drugs on, it shows to me that they didn't care because they obviously are trained in this. They obviously know about this. And I've seen these curriculums that a lot of these people, because this is something I've looked into for a while.
Mhm.
They're trained in this. They should know this, and the fact that they were disregarding it to me is a very alarming thing.
Yeah, I mean, you give them more credit. I think, I often think back to like the difference between like incompetence and just like malfeasance, and it is really hard looking back to, like, for instance, like when we got the second opinion, and the NICU doctor came in and told us exactly what the other institution recommended, which they recommended lowering the medication. And I was like, I've literally been saying that for 3-4 months. And I was like, thank you, and then I talked to the cardiologist, and the cardiologist comes in and tries to tell me, oh, the second opinion recommended increasing the medication. I'm like, that's wrong. That's not what they said. And I constantly think, like, were you just so dumb that you didn't even listen nor bother to remember? Or, like, were you just blatantly lying? Like, it's so hard. Like, how could you be so wrong about something like that? And I would tell them, like, no, I already know the information, you know, Dr. Need told me exactly what they said. We talked about the numbers, and we ran through the numbers, and, like, they recommended giving, um, a lower dose more often, which equated to less medication.
Mhm.
And then the cardiologist didn't believe. And then, like, in the end, things are really bad, and cardiology's like, they just were like, oh, yeah, we're not going to do anything about it. And then the doctor came in and we're like, oh, yeah, his heart rate's really high. We're going to increase his sedation. And then his heart failed. So that was how things ended after he had 3 pneumothoraxes because his lungs were being blown to pieces because the doctors would not lower the ventilation. So they insisted on high ventilation when his lungs were really blowing apart. Yeah. And that's something that we see so often with people, too much sedation, ventilation that's literally destroying their lungs, and then medication that shuts down their organs and makes everything worse. And then the doctors are like, oh, well, they're dying. They're just not meant to live. And they write them off when it's really just
Um,
a failed treatment plan, and some people don't know any better, and they try to trick you into this position where you have no choice. And so we fought so hard to transfer to an institution that I knew would align to the treatment plan that I really believe that Benjamin needed. Oh, did their license get yanked? That's funny. And I this was something that I related to in Joey's story, when things started to get really, really bad, and I reached out to a lawyer to talk about negligence, especially after he died. I mean, it was before he died when the mistakes were so obvious, and I'm like, how can they not be held accountable for their mistakes? Like, I feel like I need to talk to a lawyer, and we need to set up a case. And I just really, really, really felt that that lawyer was in cahoots with the hospital, and
Absolutely.
that they were all working together, and I don't have any evidence for that, but, my intuition just was, screaming it so loudly that it was like, you just went to, the bad guy and told them all the bad things, and now they want you off their floor. You know what I mean? They're like, "We
Mhm.
can't have this patient anymore because they're too much of a liability." And I don't know why they didn't just, let us transfer, and then the cardiologist was like, "He's ours." Like, they owned him. And I'm
It's
like, "You don't own my child." But it did really seem like that because once you're put in that position, they do, exercise ownership. And
mhm.
it's so crazy. So, ultimately, spiritually, I feel like I had to, surrender my child and just let go ultimately because there came a point where there was nothing more we could do. And, I think about legally fighting, but it's like I just realized I didn't wanna live that life where I was, constantly at war. I
I
wanted
understand.
to get back to, my peace, and that was, even in all these horrible, horrible things that were going on every day, I remember being in the room and like with my own spirituality, I just remember like our prayer every day was that like we were thankful for every single day that we had with
Mhm.
Benjamin because every day was a miracle. And that's something that I think we take so for granted in our everyday life, being healthy, that we don't realize every moment and every day is a miracle and that we're not promised this time.
Mhm.
And that I would like lay back and let the light shine on my face and just feel like, like God was like still holding me in this light and that I could feel this like peace inside, regardless of what was going to happen, you know, regardless of whether like my son for sure was going to be saved, like either if he was going to live or die, that I was going to be okay. And that ultimately we all are okay. Like Benjamin's in a better place now. Um, and,
The one thing
and
I
you
want
know,
to say is this. I wish I could honestly right now, I wish I could just give you and your husband a hug, man. That's
oh, thank you.
just the number one thing I want to say about all this. But please continue.
Yeah. Just, realizing that peace inside and really cultivating that. And, you have to really dig deep to find that. And some people would ask, like, how do you do this every day? We were in the hospital with our son every single day from like 7 a.m. to like 11:30 at night. Um, and I would just say I would just lean in. That's like that when life gets tough and really, really hard, like the only thing you can really do is like lean in. Some people like they're fight or flight, like they shut down, they want to run away or leave. But like ultimately as a spiritual warrior, which I feel like maybe a lot of your audience is like you have to
Mhm.
just like lean in and face it and do your best every day with what you have. And ultimately when it all was said and done, it was so confusing and hard to find meaning in all that, and I still work to that. But
I
yeah.
was going to say, Spin just said sharing your story is how you take your power back. You are
Thank
helping create awareness that parents know, and that if we have questions, we have the right to ask. Many don't even know that. So
Yeah,
you did take your power back here tonight, and I want you to know that.
thank you. Yeah. I just think it's so important that people know to like be aware, figure out what's going on, you know, and find your choice in all of that. Ask questions. I think that's so important. I think sometimes doctors are so surprised when you ask about other options, like ask like um I don't know. Yeah.
No, and I'm with you. I'm with you. No, you have to. And the number one thing, just listening to your story, is you have to walk into this as an educated individual, and this is something I feel, because we're conditioned as this society, as this American civilization, even in other countries as well. We are conditioned to blindly trust these healthcare professionals, to literally give all of our power away to these healthcare professionals, and allow them to do what they see fit, even if we're having this experience, we're having this awareness of what they're doing doesn't make sense or it doesn't seem right. The amount of parents out there that turn a blind eye to this and allow this stuff to unfold the way it does, to me, is the biggest disservice you're doing to your life and your family. And you started to educate. You didn't know, and you didn't know. You started to educate yourself. You started to learn. And that was the right step to take in all of this, and you took every right step that you could, and I want to tell you that today.
Thank
And
you.
absolutely. And and that is the message that we see, that these healthcare professionals take advantage of our ignorance. They take advantage of our ignorance for their own selfish reasons, whether it be through money, whether it be through lack of empathy, lack of compassion, lack of care towards what's going on. You know what I mean? So that is the message, I think, that is being relayed here in not just your story, but Joey's too. If your child ends up with one of these serious health conditions, and needs this kind of care, needs this required care in this health condition from these healthcare professionals, you have got to start hitting the books. You have got to start reading. You have got to start learning, how this works, what's going on. Because if you do not, they will use it to their advantage, and they will do whatever they see fit, even if it is the wrong thing.
Hmm. It's so true. And what you were saying just reminds me of what we were talking about earlier with like the matrix. I just feel like the medical system is such a manifestation of the matrix that we are in, and it's like a control matrix. And I feel like ultimately they see people, especially like as the system, as like pawns that they can just move around and do what they will, and that like we need to like take our power and choice back, um because it's our lives are not for them to control. And yeah.
And you're exactly right. And we were kind of chatting a little bit before the show on this, and in my eyes, the healthcare industry very much the same how you see it. I see it as a extension. It's a Masonic arm. It is an extension of this invisible college. And I know I know you haven't heard me talk about this before. I know people have heard me talk about this on the show before, but what the invisible college is it is the collection of intelligence agencies and secret societies that work together in manufacturing this matrix reality itself. And this is, you're absolutely right in my eyes. They see us as these byproducts of this system. And because they are from emitting from the matrix themselves, we look at what the matrix means. We see the matrix as this physical, this not real reality that's around us. So we can see firsthand that they lack that divine spark and that divine nature from within them. They don't have this. It's missing. And luckily for you, you had that one nurse who had that divine spark in her, who was there for you when she could be, trying to do what she can. And it's people like that who are the altruistic ones in this, in my eyes. The ones that have that divine spark, who they might not even be aware of totally what they're roped into at this point in time, and I mean, I was even having this conversation the other day. It's like when you see something that is morally wrong, but you're being told to do it anyways. I mean, where's that philosophical line? Where's that line? Are you still going to do this because it's an order, because somebody's telling you to do this? Or are you going to have that humanity inside of you? Are you going to reach to that humanity inside of you? And are you going to be like, no, I'm not doing this. This is wrong. And, and so I completely agree with you, Katie. I do think that, it's a manifestation of the matrix system, and it abides by matrix properties, matrix rules, and matrix laws. It is strictly of the physical and the flesh. It lacks the divine spiritual component that exists within us as human beings. So I completely agree with your sentiments on it. I do.
Yeah. Yeah, we were lucky. We had like one nurse that really advocated for us, one doctor that was, I think, the entire reason that Benjamin got off ECMO. She was the only one that supported our decision to give Benjamin a chance to live. So she's like, okay, so we're going to do the surgery to get him off ECMO. And I had said like, oh, I thought they could just like, cut the cannulas and then we could like just see if he would live. And she was like, he would clot. And so it's like she was the only one that like advocated for us to like get that much further. And then
Mhm.
like the surgeon, who was like always an advocate for us, and that you could just tell that she was like fighting up against a whole system. And like I saw her arguing with the head doctor like out in the hallway, like, what are you doing to this child? Like, how can you keep, it was like one of those conversations. And he was like,
Mhm.
yeah, whatever. And most people are almost like robotic. I feel like sometimes I think like there's almost like an like an AI signal that takes over people's minds, and then they just, all they do is like robotic through the, following the motions, doing what they're told, not thinking outside the box, not thinking critically at all. And that's what's so surprising. Like I'm like in the medical system, and like none of these people are really thinking critically, and they're just following the rules, going through the motions, and trying to like almost like keep their head down and get through their day. It's just
It is.
hard.
Well, that's what we kind of see from the manifestations of the matrix
Yeah.
system, because it is, when we're talking about just the matrix system we have here. It lacks that divine light. It lacks that divine spark. These people who put their entire stock faith, life, and belief into this system, uh they absolve themselves of that divine light. And it's almost like they become robotic. It's like they sacrifice a piece of their humanity. They give away this aspect of their humanity when they embark on this. And when you give that aspect of your humanity away like that, just so willingly, and in that quick of a fashion, it is almost like you're dealing with an artificial intelligence of some kind. And
Yeah.
who's for me to say? I mean, we can even go down the road. Who's to say that there's not some entities also that could be in play? Uh, we do have Sam coming. It does feel like some of the doctors, etc., are full of dark entities. They have their own agenda. And we do have Spin just saying there are some in it for the right reasons. I pray that they are protected and send them strength, especially those two that were fighting for you, most certainly. And then and Kyle's absolutely right on this one. Kyle, you're right on this one, man. I'm agreeing with you wholeheartedly. Unfortunately, it's just a job for
Yeah.
some of these nurses and these technicians, and they lack the humanity and the compassion when you're working with another human being. One thing we know on the spiritual journey, one of the biggest things that we talk about is when we're looking at another human being, that's another you. That's another subjective focal point of the divine. That individual has feelings, love, a family, people that care about them, just like you do too. I don't understand how that deviation could occur in somebody, and the only way I can explain it is they sacrificed an aspect of their humanity. And that to me is the only explanation, especially in dealing with what you dealt with.
Hmm. And going back to like what you said about the divine spark, and everything that like I just feel like sovereignty was just like screaming so loud that like
Mhm.
holding on to our sovereignty and being just like enacting our sovereignty is so important. And that's like one thing that you know they generally, they want to control people. They want to you to do everything they tell you to do. And like ultimately as spiritual beings, like we are sovereign, and we need to really step into that um as much as possible. And that's like one thing that's so important in the healthcare system.
And
To
that's my favorite word is sovereignty. But
know,
keep going,
it's
yeah.
just like so, it's like I am sovereign, I am sovereign. That's just, it's so important.
It absolutely is, and it's my favorite word for many reasons. Because when we embark on our spiritual evolution, that's our ultimate goal, to be sovereign. Nothing rules us, nothing controls us. We have our own perspective. We cultivate our own reference point for our path that we choose to carve. We cultivate that sovereignty within us, so nothing can have control over our minds, our bodies, and our souls, and that's why it is such an important thing. And it is, they want to relinquish that sovereignty from you. They want to relinquish that control from you, because that sovereignty is threatening. That sovereignty is not just threatening to the healthcare system. That sovereignty is threatening to the system overall. And that's why they try to beat the sovereignty out of this collective. Some people fall for it. Some people, like us, we stand strong and we maintain it. And we would rather die free in our graves than live at someone else's knees. And that's truly it. And the fact that you held on to as much as your sovereignty as possible during this whole process is quite profound. Especially dealing with what you were dealing with.
Yeah,
And
especially with a child, that's so hard, because it is a life outside of you, and it's crazy when you have children. You in a way like give your children to the world, but it's still like, they are sovereign being, and you are the only person to help protect their sovereignty as their guardian and protector. And like these doctors in this whole medical system, like they just think, especially when you step into their system, they think that they own your body. They it's like your body is theirs to do what they will with, and it's just so hard. And I totally agree that's like, no one should go into the hospital unless they absolutely have to. And if you are in that position, to just like have your wits about you, have an advocate, get smart, be aware. And I think even like it's so hard to be a spiritual person and enact boundaries. Like, it's like one of those things that's like, oh, like just because you're spiritual doesn't mean that you're a doormat, that someone can walk all over you. But you need to do that with respect for all people. And that's so hard when you're pushed to the very limit, and like you're like facing death for you or a loved one. And then all you have to do is like stay sane and stay respectful. And like, you're trying to kill my child. And then they're like, don't be rude. It's like,
you're not being rude. You're
so hard with
stating
people.
you're stating facts there. I mean, and it and that's my biggest thing too, is because one of the biggest misconception that a lot of the general collective has about the spiritual community is that we are just these pacifistic doormats, when in reality a lot of us are fuck around and find out. Like we choose peace. We choose peace because we have seen violence, we have experienced violence, we have endured violence, and we know that's a last resort. That's not our first go-to. We don't want to do that. You know what I mean? We try to. That doesn't mean that if worse comes to worse and we don't have a choice, that we're not going to do what we need to do. And that's one of the biggest misconceptions that a lot of the general collective has about the spiritual community, is that we are just these pacifistic doormats, and we're not. And enacting boundaries is healthy. It is probably the healthiest thing, and I'm even going to say this too. There's a meme that's been floating around that says sometimes the most spiritual thing you could do is tell people to fuck off. And the reason why I'm like, yes, and we have Don says I was street before I was spiritual, but it is sometimes, and it necessarily may not, fuck off might not be the thing to say, don't get me wrong, but you get the point, you get the context. Like setting those boundaries is and one thing I call it is sometimes you have to be a little selfish to remain selfless. And what I mean by that is if you feel like you're being taken from and your boundaries are being crossed, or like you feel like people are poking and prodding and stealing from your energy, it is the absolute right thing to do to cut them off. Be selfish for that little bit of time with your energy so you can remain selfless. It doesn't make you bitter. You know what I mean? And that's the best piece of advice I could give anybody. I don't know. I think it's a lot of the spiritual gurus of old, like Gandhi and people like that, who kind of like set this precedence, even though Gandhi was kind of a piece of crap. I mean, we all know that story, but they set this precedence of like pacifism, doormat behavior, you know, not, and yes, of course, you know, during the spiritual evolution, yes, we want to play non-attachment with our beliefs. We want to open space for others to, you know, to share their story. But the minute that starts to take energy from you, the minute that it starts to encroach upon your boundaries, the minute you have every single right within you as a divine sovereign being to cut that off. You know, and that's what you have to do. And especially in your case, you know, staying calm with these doctors, because what these individuals are looking for you to do, and you didn't cave into it, which is awesome, is they're looking for you to flip your lid. They want you to flip your lid, because the minute you flip your lid, CPS gets called. And then after CPS gets called, that opens up a whole can of worms into another situation that you definitely don't want. And so that's what they were trying to get you to do. They wanted you to react poorly, so they had the excuse to do what they needed to do to take further. And the fact that you did not cave into that, I give you applause.
So for me, and I feel like this was something similar that Joey had mentioned in her story, was that they were like constantly threatening to kick us out of the hospital for touching anything, because like nothing could be touched. I was like, this is ridiculous. Like my son is like hooked up to all these things. So they were like constantly like looking for a reason to like get us kicked out. And it was just like so crazy. And like to a certain extent, like especially in the beginning, it's like no one had mentioned these rules. Like it was like in the beginning, because you know, he was critical. He was we would be in situations where there would be like everything alarming all the time. And that alone is a really hard situation to be with. Like when I talk about
Absolutely.
like stillness in the storm, like when like every single thing is like almost like screaming, like the reality is like everything's beeping, and then like excessively beeping. Like in the beginning, the nurses would be like, oh yeah, can you pause that alarm on the screen? Will you pause that? And then all of a sudden they were like, we're gonna kick you out because you touched the screen. It's like the nurses had like asked us to. And then it came to a point where it's like, we'd be like, oh, is it okay if I pause this? And then we'd like ask permission, and that was still very not okay. And then it became progressive. Like we would have some really weird nurses that would just like almost like in the spooky sense, like they were just like so freaked out. I think one of it was because Benjamin's level of care was almost like too much for them to handle. But I don't know why, like almost like, you know, as a spiritual person, that like there are certain people that you encounter and they like somehow see you as an adversary even though you haven't done anything. They're like, oh, you're the enemy. It's almost like this like robotic hive mind thing. So we'd have these nurses we'd never met, we'd never seen before. And like the one like sent this whole email about how like, I don't know, like they try to kick us out because we like moved the bed a little bit. We're like, we've moved the bed 100,000 times. Like all of our other nurses like let us move the bed. They told us we were allowed to move the bed, just like, hey, like we're gonna move the bed, okay? Like boop. And it was just like the weirdest thing. And so like the one night, it was the middle of the night, Benjamin was having a bad time. His saturations kept dropping, and the nurse was like really busy, and I like gave him one boost of oxygen. There was like this one button, then all the nurse had to do was like click boost of oxygen, and so it would like help him through like a hard time when he was like struggling to breathe. He needed a lot
Mm.
of oxygen. And then like I got caught clicking that one button, and it came to that point where like my integrity was in question.
Mhm.
And I'm just like an honest person, I guess, to a fault. Like she had
I
come in,
understand. I understand.
she'd come in and she was like, did you give him oxygen? And I was like, yeah, I did. Even though like I knew that was gonna lead to me being kicked out, because they would already had threatened for like all this ridiculous things that we had done. Like my husband would like try to like move a towel that like had his intubation tube on it, and then they would be like, you try to touch his tube, we're gonna kick you out. Like we were just like moving a towel away from his face. It was just like the craziest thing, that it was like this ongoing thing. And so they kicked me out of the hospital for a day. And I just like took it. I was like, yeah, okay, like I'm not gonna flip out. I'm not gonna fight it. I'm not gonna pretend like it didn't happen. I'm not gonna lie, and know that I was just like lying to get by. And I almost like held them to it. Like, you're really doing this. Like, I know other parents from other hospitals, they were allowed to do that. They were allowed to give their child oxygen when they're struggling to breathe. Like, when you go home, you get sent home with a ventilator, the
Mhm.
oxygen is all on you. But in the hospital, they're like, no, we control that. You're not allowed to do any of that. Like, this is all ours. You can't do any of this. This is like, and now you won't be able to like see your son for a day. And that night, he ended up having a terrible time. It was this new doctor. It was the same doctor that ended up like the night that he died, giving him the Precedex that killed him. And so he was having a bad time. And they called us, and my husband said, oh, you should go in and see Benjamin, because like at this point, like it doesn't matter. And I knew I just had to be like true to the words. Like, no, they said I can't go in. Like, I like really can't go in. And I think if I would have gone into that night and like not like followed their rules to like be kicked out for 24 hours, that something like really, really, really bad would have happened, because they were like trying to throw everything at us to try to like control us as much as possible. And then, yeah, like with the transfer, when they were lying for so long, they told us for weeks and weeks and weeks that our transfer to another hospital was being processed. And then I eventually found out that no one had ever called to process a transfer. Also,
Dude.
all these people were just lying, just saying like, oh yeah, like, oh, this transfer nurse is going to come and talk to you on Monday all about your transfer. And I was like, well, why didn't she come? Like, all this stuff didn't happen. And then it was like this big debacle of like how the transfer request never got sent. And then it was like this thing of like, oh, it was that person's fault, and oh, it was that person's fault. And it was eventually like the cardiology team was responsible for calling. And then they said, oh, we didn't feel like it was our responsibility. It should have been someone else's responsibility. So like just no one would take accountability to do it. So it just never got done. And then they just lied to us about it for like the longest time, for like weeks and weeks. And it's like, it's so crazy. And then like navigating the healthcare system alone is so hard, especially when you
Oh yeah.
know so little. So like that alone is like a huge learning curve to figure out how they even do stuff, and like who to call when something goes wrong. I do feel like in our day and age that patient advocates should be much more popular. Like in the hospital, there should be a patient advocate
100%.
that you should be able to call at any point.
And what I feel like too, that one thing I wanted to touch on, I wanted to tell you real quick. So you will, and then let's touch on the patient advocates. So you were talking about how like you feel like sometimes people see you as an adversary for no reason.
Yeah.
And there's two reasons for that I've come to find. The first main reason that I've encountered to myself, because when you said that, that's why I chuckled. I was like, man, story of my life.
Yeah, right.
It's because you have that divine spark within you, Katie, and you
it's that frequency.
So if their consciousness or their soul is not ready to experience something like that, a frequency like that, from a particular individual, another soul, another focal point of the divine, what does is it manifests on the surface as a dislike or seeing you as an adversary. And yeah, you have people, I've had so many people in my life that have just not liked me for no reason. There's people still to this day that don't like me for no reason. And and that's mainly because you have that divine spark within you and you've cultivated that connection within yourself. Number one, you're holding a mirror up to them just by existing. And when you're holding that mirror up to them just by existing, that's where that starts to manifest as the dislike, the adversary, because they're seeing all of this stuff in you that they think they don't have. But in all reality, if they could just understand that they also have that within them as well and come to that realization and come to that remembrance, it would be a different ballgame. Now, the second reason for that, which is there could potentially be a negative entity involved, potentially a negative entity attachment with somebody. And because that negative entity sees you in your divine light, it immediately knows you're a threat to what it's trying to do. And it is also going to manifest on the outside as the adversary complex or the extreme dislike or disdain for you. And it seems like you just wore the wrong color shirt that day. Like it was just, you just wore the wrong color shirt and this person doesn't like you. And those are the two reasons I've come to find out in my own evolution as to why that happens. Also, for the advocates, I completely agree with you. I think these advocates need to have some kind of authority, and I think they need to be a non-biased third party that does not work with the healthcare system or the legal system as well, because then what that does is that weeds out any conflict of interest, that weeds out any kind of intermingling that could occur between this advocate, the healthcare system, and the legal system as well. So I'm with you. I do think that this needs to be something that is more prominent. This needs to be something, and maybe by us doing this show tonight, we're putting out into the collective consciousness for this to manifest, especially in a situation like yours. And it's just, they need to have something, because these individuals are making these parents feel so powerless. They're taking the power away from the parents. They're stealing your sovereignty. I mean, it's your child, and I'm sitting here talking to you, and you're a spiritual, mentally sound person. You're not some individual who needs to have CPS called on them. You know what I mean? One that's not taking care of the child, one that's not doing that. And even there, I still think there's many other routes that can go down before you start getting the government involved in something along those lines. But I'm with you totally. So real quick, the one thing, we're coming up on the hour and a half mark and everything like that. So we're kind of getting towards wind down time. But if you don't mind, just for a little bit, I want you to kind of share how Kundalini yoga helped you through this, because yeah.
Like I said, I had dabbled with Kundalini yoga. I had done it quite a bit throughout my life as just like a spiritual practice that I always found very sound. But I found it especially healing after this harrowing experience. And I learned so much. Like once you start working with it on these kriyas and doing these movements and this breath work, like you start to see how it works with and in your body, like the breath work, and like rewiring your entire nervous system in terms of like accessing that fascia that like trauma gets stored in and allowing it a safe place to release. Very similar to like trauma release exercises. They're so similar in somatic release. Like even the breath work itself is definitely a somatic release. And so yeah, I just really found a lot of grace in my spiritual practices. Coming home from the hospital and grieving, especially intensely, probably both very, with intention for a year, and doing Kundalini yoga very regularly to help heal the trauma in my body. And I think it helps with PSTD, which is like one of those things that you're just going
Absolutely.
to experience from being in a hospital in an ICU setting for so long, and losing someone, especially in a traumatic way like we did. And yeah, one thing that my teacher that I worked with talks about, like, it's like when you're doing the Kundalini yoga, it's like in a way like putting yourself into a fight or flight kind of mode with the accelerated breathing and rapid
Mhm.
movements, but doing it in the safest, most sacred space possible, and then
Absolutely.
releasing it, and then really coming back to know that you are safe and you are held and you are here and you are present and you are focused and aware of like your own healing process and like what is in your body. And then stuff starts to come up, stuff that you start to like realize and maybe relive. Maybe you start to get like realizations within those feelings, and then being able to move through that, which I think is like all about like why we have these emotions as humans, and in this like human experience, is that they should really be moving through us. And so many people, they get
Absolutely.
stuck. It's just natural that the emotion and the trauma and the heightened experience feeling gets stuck in your body, and that we want to like just tuck it in and not let it flow and release it, especially like in a proper and safe manner. So that's why I think like Kundalini yoga is like so important, and it really, really helped. I feel like return my nervous system back to a state. I had like a psychic recommend EMDR, and I feel like Kundalini yoga like really did the same thing that therapy can do, where you like access the feeling and release it. So you can still remember what happened, but that um all that anxiety and
Mhm.
sadness and grief and isn't as charged or like in you. So you can remember, but you don't like feel like
Mhm.
the same that you felt in those moments. And so yeah, it's,
Uh,
I think, a really powerful movement. So yeah. And
You
I
hit the nail on the
travel.
head.
Yeah. I live in like a small town, so I traveled an hour to go to my in-person Kundalini yoga class every week. And, I had an incredible relationship with my meditation teacher who also taught the
Amazing.
yoga class, and, meditation
Amazing.
alone. And in Kundalini yoga, you do so many interesting kind of meditations with
Mhm.
different kriyas, and then even kind of like the wind down, like my teacher would have like a really amazing meditation in the end, generally like going through the chakras and just like looking in to see what's there, and releasing and healing all of it.
Sitting in that present. Yep. Sitting
Yes.
in that subtle energy in that present moment that you just
Oh my gosh.
cultivated. And yeah, like you hit the nail on the head. It's very much it's a somatic release. It's a way we can release the effects that this trauma throughout our lives and these very stressful scenarios that we've been in, it releases them from our fascia to be, at least in my terms, alchemized.
Mm.
We take that, we take the, because when we look at these emotions hold energy, like especially this trauma that we experience, and this energy, it gets stored in our fascia, which is also where our subtle body system is, the chakra system is interwoven into to our fascia. As it's like that's the one big thing I tell a lot of my listeners, and I'll say it again: the chakra system and the subtle body is not it's not metaphysical speculation. This is a very real thing. And for those of you listening your first time, if you want to watch my show on the subtle body, I basically showed you it's a very real thing with NIH studies of the individuals showing the meridian points within our fascia where this energetic system actually exists. So, and we're releasing this energy. Thank you, Don. I appreciate it. He said this was a healing episode. Thank you both. Jamie, Angel Wings, empathy seems gone. Compassion has gotten lost or blocked. Even it's crazy. Feel empathy is how you get your gifts. And if you can't sense empathy, it's gone or blocked. Definitely agree, Jamie. But I want to say you hit the nail on the head. This is why and you're probably going to agree with me when I say this. If more people started doing Kundalini yoga, it would quite literally obliterate the mental health care system as we know it today.
I would hope so.
I in my eyes, I'm with you. In my eyes, it would. I mean, and I'll give you a little bit about me. So, like, I had tried a lot of things to work through my trauma, and the stuff that I've been through in life. And when Kundalini yoga came to me, in just the almost 2-year span now, I have been doing Kundalini yoga. My healing in that 2-year span has been like 400 fold compared to the years prior to me doing it. It was a very slow kind of picking process in the years before I started doing the Kundalini Kriyas. And when I started doing the Kundalini Kriyas, it accelerated my healing to a point that I can't even explain in rational words.
Yeah.
And that's what it's done. And I see that it's done that for you too. And I think, and I joke because, I joke and I say I'm the Kundalini yoga spokesperson here. And, but now everybody out there who gives me crap for that, you see exactly why I am the Kundalini yoga spokesperson here, because of how much it has not just helped me, but you can listen to Katie's story here too on how much it helped her. And, nonetheless, Katie, there's a few things I want to say to you before you sign off. If you can hang out just for a couple minutes after we get done, I want to chat with you about a couple of things.
Sure.
Also, too, I want to say how profoundly strong you and your husband are, for making it through this. I wasn't lying when I said I wanted to give you two like a virtual hug, man. Like, I'm sitting here listening to your story and I'm just like, the fact that you're still here standing with us today and you've taken the lesson from your experience and everything you've undergone when it came to your son, and you've transformed yourself through this process. And it not only brought you closer to the divine, it brought you closer to the peace within yourself. And that peace that's all there, and that the peace that we all deserve in this life as living, breathing, divine human beings. And I want to say, yes, absolutely. I'm not even BSing you. Like, I was sitting back and holding tears back for a lot of this show, just because, I'm not a parent yet. I hope to be one day. But I can't even begin to understand and grasp what it must feel like to undergo one of these scenarios like this. And I felt it through your words. I did. And I was kind of sitting there with you through it all. And I got kind of a glimpse of the understanding. And you're a spiritual warrior, Katie, and don't ever doubt yourself, okay?
Thank you. Yeah. And I feel like there's a lot of spiritual warriors out there. And I just, like when you said, about everyone having this peace, I want everyone in the world to be able to access this peace within and hold that, because everyone deserves that, no matter what kind of struggles they go through. I always say hard is hard. People have different struggles, and I think you know, bringing children into this world is like the most amazing thing that we can do, but it is also the biggest spiritual lesson I feel like life will ever give you. And I never expected, the spiritual lessons of parenthood to come in the way that they did. But, we don't, get to pick what's given to us in a certain way that like our experiences are. And I just wanted to go back to like kundalini yoga and like how powerful it can be, throughout anyone's journey. And it's like when I started it when I was like really young, like I was having like a kundalini awakening and it opened up so much within. And some people say it's like 3 minutes of breath of fire can like burn away like lifetimes of karma. And I just feel like that acceleration is so real. And sometimes I feel like, when that also means that sometimes that we'll have really, really great challenges to overcome, because that was like one of the lessons I learned like in this, like, sometimes like you don't even know like what a true miracle is until like your back is against a wall and like you feel like almost like there's no way out. You know what I mean? Like when you're at the very bottom is when I feel like people experience the most miracles in their life. And I feel like anyone who's like overcome addiction or anything like that really understands that kind of like phoenix rising from the ashes, that like no matter what you're going through, like I want everyone to like access and hold on to that peace inside and know that they can get through it and that there's a light on the other side and meaning within all of it, even though it might not make any sense at the time. So
dude, you're speaking my language. So real quick before we sign off for tonight, I have your X profile in the Rumble and the YouTube description in case anybody wants to reach out to you and chat to you, if that's okay with you.
Sure. Yeah.
And but if there's anywhere else anybody can find you that you're comfortable with, why don't you take the time to let them know now?
I'm like my anatomy a little bit, but
It's totally up to you. You don't know if the X profile is good to go. No worries.
Yeah, I don't post a lot.
Yeah.
I like to comment and I like to, respond. And that's how I met you, just like, being out there responding, saying, bits of my story here and there when people are ready to talk. But yeah, just a, normal woman living her life and just,
Totally get it.
So yeah.
I totally
like I don't have like a big platform or anything that I'm trying to work on. So
no, totally. Well, Katie, I want to thank you so much for joining me tonight. To all my viewers and listeners who will be listening to this on the audio platform as well, I think the lesson we can draw from this is we need to be educated when it comes to this healthcare system, the sleight of hands and the deceitfulness that they try to pull on us, not just as adult individuals, but as parents with children. If my number one recommendation to everybody is if your child gets some kind of severe health issue that requires that kind of medical care, the number one thing I'm going to say you do is you hit the freaking books. Dude, you hit the freaking books. You learn everything you need to know about this condition, how it's healed, what can be done, the alternative methods, the conventional methods. And I'm even going to go on the line and say, make sure you have a lawyer on lock and make sure you find one that's not interwoven and it has a conflict of interest when it comes to dealing with people in the healthcare system that is around you. We have to start stepping up the power that we have as people, and we need to start stepping our game up when it comes to this, because if we continue to allow things like this to continuously slide by from us, that we're giving them the impression that we don't care. We're giving them the impression that this is okay. And we can't do that as human beings for ourselves, our loved ones, our children, everyone. We can't do this anymore, guys. So that's my advice to you, as you can hear from Katie's story tonight, is that you need to hit the books. Even now, even if you have children now, start hitting the books. Okay, start learning, about these things and these processes, and make sure you cover yourself and you keep your family safe.
Yeah.
All right, guys. Oh, go ahead. No, were you gonna say, Katie?
Oh,
No, my God.
yeah, I was just saying, be educated and know your choices. And I think it's so important that, those things go together. That like, that you have a choice and always have hope, for doing things a different way. No matter how much it seems like, always have hope for doing what's right for you and your family. So.
Absolutely, absolutely. Well, thank you again for joining me for another BG Cast Wednesday live podcast. I will see you guys next Wednesday. I hope you can take from this a learning experience, and I hope you can also take with you some strength for anything that you're dealing with in your life at this point in time. And how we are here at BG Cast. You are going to stay safe, and you are going to stay free, and most importantly, you are going to stay sovereign. Have a good night, everybody. Take care, and I will catch you next Wednesday.